Hello, everyone. This is Dr. Mobeen Sayed, and welcome to the Cool Beans Cafe Live. Today, we are going to talk about a very important set of studies. And the message that I want you to keep in mind is the following: type 2 diabetes mellitus is reversible, and the beta cells are repairable. So, we should always look at type 2 diabetes, especially from a point of view of can I reverse it? This is a paradigm shift from older traditional approach to type 2 diabetes mellitus, where we say that type 2 diabetes mellitus is a chronic progressive disease. It is chronic, it will continue, progressive, it would keep becoming worse. The newer paradigm says it is a reversible disease. It's a huge difference. The second thing that I want to present to you, which is fascinating for me, is how type 1 diabetes, which is most of the time type 1 diabetes, is not, it needs insulin. It's an insulin dependent diabetes. Pancreatic beta cells in most of the types of type 1 are destroyed by the immune system or for other reasons. And there is no hope. There are no beta cells. As the child continues to grow at various ages, they run out of beta cells. And so they don't have insulin making cells, and they then have to get insulin. And I'm going to present to you a study that showed that they made type 1 beta cells, or beta cells, the insulin producing cells, from the pancreatic acinar cells or pancreatic ductal cells. In simple words, they were able to take pancreatic cells and they were able to open their genes so that they start making insulin. So there have been other studies as well there for where they made the stem cells into beta cells. There was a recent study from China that showed that. This is a very different study. Here they took a person's own beta cells, sorry, the glandular cells from pancreas, which were not beta cells, and then they converted them into beta cell with an FDA approved drug. So that is also a hope. The only thing is they cannot give that drug to a person and hope that the beta cells would recover. They'll have to take the beta cells out, some beta cells or some ductal cells, then put the drug on them. That drug would convert them to beta cells. Then they culture that and give them back to the person. So this is kind of an autograft. The the reason that this is important is that in type 1, either they stay insulin dependent forever, or if they need to have a pancreatic beta cell transplant, there have to be 3 pancreas that would allow enough beta cells to work as one pancreatic set. So that's not possible. So this is a great study as well. This is why I wrote in the title of this study, this video, that type 1 and type 2 diabetes mellitus is reversible. So let's look at these studies together. And this is a chit chat as well. So thank you very much for joining. I hope you're doing well. Um, let's look at these studies. These are amazing studies. And then we can, in the meantime, we can continue to do um, chit chat as well. So this first study, you are all aware of it, those who have been with me for some time. This is Dr. Jason Fung from Canada. He's a nephrologist and I believe endocrinologist as well. This is a study by his team where they demonstrated with 3 cases that people who were insulin dependent, when they did insulin dependent type 2 diabetics, when they did intermittent fasting, they recovered. My apologies. There is a problem with my internet for 2 years now that after 6 o'clock, for a few seconds, it always disrupts. So maybe I should change my time from 6 to 6:30 or pull it earlier to 5. But my apologies. I hope I'm back. Am I back? Janet says, Luffy did it. Okay, cool. This happens every time. For a few seconds, the network just goes away. And we are tired of telling Comcast to fix this. And it's just, this is a problem. So back to the study. So this study, you have seen it all, that there are 3 patients here in this. If you see here, patient 1, 40 years, male, 20 years of diabetes, patient 2, 52 years, male, 25 years of diabetes, patient 3, 67, male, 10 years of diabetes, plus comorbidities. And as they started intermittent fasting, within the first 2 to 3 weeks, they had become insulin independent. And then the remaining diabetes also became controlled. So I'm not going to go into the detail. In the references of this study, there is this book, The Complete Guide to Fasting, and their protocol is in here. This is the reference number 7 in this study. So you can actually just go to that book. I also have a bunch of copies of this book. So if somebody wants them, just tweet at me and I would send you that book free of cost. Now, the next study that I want to share with you is the following. Repair of damaged pancreatic beta cells, new hope for a type 2 diabetes reversal. This is 2021, September 28. This is an enormously important study. For the first time, they are proving that pancreatic beta cells can be repaired. So let me draw this part before I show you the study. Here is what they're saying. And I hope that a lot of people watch this video, and if not, then you mention it to them, because this is an important piece of information that we all have to know. We are going to encounter this disease at some time. So here is what happens. Our thought was that the beta cells, these are the cells in the pancreas whose job is to produce insulin, correct? So glucose, when you eat carbohydrates, even anything that is irritant for our cells, anything that causes oxidation can cause beta cells to release insulin, but the normal thing is carbs. So when you eat glucose or carbs, they cause the beta cells or beta cell, whichever way you want to pronounce it, beta cells to release insulin. And then the paradigm is, the older traditional paradigm is that there are 2 primary problems that occur. One is that the peripheral tissue cells, so let's say this is a liver cell, hepatocyte. These cells have insulin receptors on them. When insulin binds there, then the receptor opens up the gates for glucose to come in. Glucose to come in, and this is glucose channel or glut. Glucose transport channels or glucose transporters. So presence of insulin that is coming from the beta cell, this insulin, when it attaches to the insulin receptor, that causes the glucose channels to appear on the surface of a cell, and then the glucose gets into the cell. This is the normal understanding. And what happens is, we also understand that one problem that occurs is that somehow these cells become resistant to insulin. So you attach insulin to them, even then they do not work and they do not open up their glucose transporters. So the glucose actually cannot get in and it stays out in the environment, where it causes non-enzymatic glycation and causes tissue damage. Plus it causes osmotic pressures in various cells and causes damage. I've done those discussions before. That is also not the important thing. The pathophysiology of diabetes is not important today. Understanding how to reverse it is important. So this is one problem, peripheral insulin resistance. And there are many reasons for this to happen, so I'm not going in there. The other problem is that we say that these cells, the beta cells in the pancreas or beta cells of the pancreas, they commit suicide. They die by apoptosis. So why do they die by apoptosis? When we have too much pressure on them, when we have too much stress on them of carbohydrates, of irritants in our food, for example, preservatives, emulsifiers, food colors, and 4,000 more agents in the food, when they're present, they cause stress on all of our cells and cause inflammation, and they would cause stress on the beta cells as well. And the beta cells in turn, when they become too stressed out, they start dying. This is the traditional understanding of the pathology of diabetes. However, the study that I'm going to show you, the researchers proved that it is not that the beta cells die. Instead, the beta cells convert into a hibernated state. They are still present and they are hibernating. I'm using the word hibernating. They did not use it. And I'm going to explain what do they mean. So let's go for a second to explain what did they mean. What they're saying is, in our pancreas, we have stem cells. Stem cells are the cells that give rise to other cells when they divide these stem cells, when they divide and give rise to daughters. When they give rise to the daughter cells can become committed to doing something. For example, this is a stem cell which cannot make insulin, but it can make a daughter cell that will become beta cell and will become committed to be a beta cell and make insulin. Kate, thank you very much. Right? It makes insulin. So check this out. This is a very, very important paradigm, which is, it blew my mind. So I wish that you kind of capture this message. So it becomes committed. So let's say it becomes beta cell. This process is also called differentiation. Differentiation. What does that mean? That this cell got differentiated into a specific role. It committed to becoming a beta cell. It is just like a baby when it is born, doesn't know what it's going to do, but when it grows up, the baby says, I'm going to become a doctor. So now it has differentiated into a doctor if it becomes a doctor. However, stem cells can give rise to cells that are of their own type. That is how they replenish their own community. We need stem cells all the time in various tissues and bone marrow to make new cells. We do not want the stem cells to divide and become a committed cell and then there is no more stem cells. So stem cells by definition are the cells that can make other lineages of cells plus their own type as well. So check this out. If you get just this part that I'm going to explain for the whole lecture, that is sufficient. You're good. The researchers found that when a beta cell is under stress, it causes the cell to de-differentiate. De-differentiate. What does that mean? Look at the de-differentiate. It becomes the parent type again. It closes the genes to be a beta cell and it becomes the stem cell again. That is its way of hiding from the stresses of producing beta cell, of stresses of being a beta cell and stresses of producing insulin. So what does it do? It de-differentiates itself back towards the hibernating cell or stem cell. When it becomes a stem cell, the stem cells are not able to make insulin. So effectively, this person does not have an insulin producing cell anymore. And we, the doctors and the research community, would look at that and will say, okay, the mass of cells in pancreas that were making insulin have reduced, and we think these cells have died. But actually, in a reasonable time, and what is a reasonable time? They looked at people for up to 6 years of being in diabetes. Within the reasonable time, the beta cell has actually not died, has not caused apoptosis. Instead, it has become de-differentiated into the stem cell. Then the researchers found that if you reduce the stress on the system, if you reduce the oxidants in the system, if you reduce the inflammation in the system, if you reduce the causative factors, the stress inducing factors that cause this beta cell to become the stem cell, if you reduce them, this stem cell would once again redifferentiate to become the beta cell, working beta cell. So in our English here, we have this term that somebody assumed the fetal position, they were so much stressed out. This stem cell, this beta cell, assumes the fetal position and becomes the fetus again, becomes the stem cell again. But if you give it a relaxed environment once more, it would say, okay, fine, I'll start working as a beta cell, and it redifferentiates into a beta cell. What a beautiful mechanism. So that means if you are diabetic, so I want to put one more concept in front of us, the 6 years concept. Imagine that this is the total volume. This is a pancreas, and it has the islets of Langerhans. And let's say I'm going to say that this much of the cells are all beta cells. That is the total volume of beta cells in here. What happens is that as our cells become, beta cells become stressed out, some of the cells would become hibernated. And I'm using hibernation is my term. They will become de-differentiated is the right term. Some of the cells would actually die because they stayed under so much pressure. And that pressure, even when they become de-differentiated, this stress and the oxidation was still present, because even these stem cells are experiencing the stresses, but they're not getting glucose in, and they're not making insulin. And every time glucose comes in, that causes even more reactive oxygen species and just kills this beta cell. Not kill, but cause it to have severe stress. The stem cell does not have that kind of a stress, but still it would have a stress if we are not comfortable, if we're not doing the right things with our food and our lifestyle. So now imagine that these beta cells have become de-differentiated while the remaining pool is still working. Now the stress continues because we continue to eat badly, we continue to gain weight, and we continue not to do exercises. We continue to stay in a stressful environment. And so more of the pool becomes de-differentiated. Some more cells here that were de-differentiated die as well. So you could see that this would continue to grow. So it is not necessary that if somebody has diabetes 6 years ago, then all of their pancreas has become de-differentiated or has become apoptotic. A part of it may have become apoptotic and will never come back. A part of it is going to be de-differentiated and can be re-differentiated. And a part of this is still working. So that's a huge help. That means even if somebody has diabetes for 20 years or 30 years, it is not necessary, even if they are insulin dependent, it is not necessary that their beta cells have died. They have become chronically insulin dependent. If they allow their pancreas some rest and relaxation time, the pancreas would start having the beta cells redifferentiate, the stem cells redifferentiate into the beta cells. And you can imagine if the cells go back to being a normal beta cell, the pancreas would function correctly, right? And then I'm going to show you one more study because I have made this little illustration of a pancreas. So let me put that study in front of you as well. There is another study that says 2-cycle hypothesis. What that says is that when we gain weight, when we gain fats, there is fatty liver that develops and there is fatty pancreas that develops. It is the fatty pancreas that causes inability for the beta cells to function correctly. So if you remove the fats, you liberate the beta cells and they can start working again. I think that theory of the 2-cycle theory plus this research that is found, they can be merged together to say that when there is fats in the pancreas, the beta cell de-differentiate back to the stem cells, and when you remove the fats, they redifferentiate into the beta cells and they start working. Paul says, I wonder if other stress cells de-differentiate back to stem cells and return. This could be an equilibrium and not a one-way conversion from stem cells to Absolutely, it is possible that some stem cells over here that have become de-differentiated could be re-differentiating while this one is de-differentiating, because these got some chance to become rested and relaxed. However, in the study that I'm going to show you, they actually provided them an opportunity to redifferentiate, and the patients felt better. So let's look at that study. What an amazing set of studies I have today. So this one, repair of damaged pancreatic beta cells, new hope for a type 2 diabetes reversal. So if you see here, type 2 diabetes mellitus is a complex and heterogeneous metabolic disorder characterized by the damage and eventual loss of pancreatic beta cell resulting in abnormal insulin secretion. So look at their wording here, by the damage and eventual loss. If this was a study that was done before these kind of studies, before more contemporary science, over here the word will not be damage and loss. They would just simply say beta cells are lost. Pancreatic beta cell dysfunction, including reduction of beta cell mass and function, plays key role in the onset and progression of type 2 diabetes mellitus. They are just saying what I just presented to you. Influenced by the findings of the UK prospective diabetes study, the traditional view is that once diabetes is diagnosed, traditional view, beta cell function decreases at the rate of 4% per year, and the conventional treatment cannot reverse its progress. This is conventional. This is the background to the failure in addressing the two key causes of diabetes, namely insulin resistance and beta cell failure. So then they discuss here, in the recent studies, they say, apoptosis has been considered as the main contributor. Apoptosis is cell death under stress. Apoptosis has been considered as the main contributor of beta cell dysfunction and decrease in beta cell mass for a long time. So they're saying, we have been thinking about this. I remember I studied that in the medical college as well, that the beta cells die and the pancreas gets burnt out. That is what we used to say all the time. However, more recent studies have shown that the loss of functional beta cell mass is not as much due to beta cell death, but rather due to beta cell de-differentiation when the beta cells are exposed to the metabolic stressors, and islet beta cell de-differentiation may be more important than beta cell apoptosis. So the beta cell going back in the fetal position or becoming the stem cells again, that is a more important thing because you can coax them to redifferentiate. Moreover, the de-differentiation of islet beta cells is reversible. You can redifferentiate them, which provides opportunities to prevent or reverse beta cell loss in type 2 diabetes mellitus. In the wake of injury factors and metabolic stress, beta cells become de-differentiated to resist external injuries. They lose their differentiation characteristic and stop secreting insulin. So they're saying that they lose their commitment of being a beta cell. They go back into the fetal position. They become a stem cell and they cannot secrete insulin anymore, but still express the markers of progenitor cell. This is a very important thing that they are saying. What they're saying is this cell, the stem cell, the parent cell is called progenitor cell. The daughter cell that became something else, in this case beta cell, is the committed cell. The progenitor cell or the parent cell has its own markers. You can measure them. You can see if the stem cells are present. You can see if they are working because they have their own secretions and they have their own designations of various protein clusters on them. They have various markers on them. You can see them. Similarly, beta cells have their own unique markers, just like I am unique from you and you are unique from somebody else. And we can see those markers. They are saying that they saw that when the beta cell goes back and becomes de-differentiated, it actually starts exhibiting the markers of the stem cell. And if you re-differentiate it, it resumes to show the markers of a beta cell. So it's a reversible process, and you can observe that. If beta cells do not die or stay in the late stage of cell degeneration during the process of apoptosis, they will become de-differentiated, cells in the quiescent phase. Quiescent phase is a cell cycle phase where the cell is just sitting there quietly, not dividing, not doing anything, just silent. Before irreversible changes occur, removal of the damage factors can drive beta cells to undergo redifferentiation and restore its function. This is the only statement I wanted to present to you. You can, if you like, you can stop watching now. This is the statement which I wish you write down somewhere, because if you or somebody else has diabetes, this is the key statement to follow. Beta cells can be redifferentiated. That means you can go back from type 2 diabetes to normal, or towards normal, if not fully normal, depends if some cells have died. More evidence proved that type 2 diabetes mellitus reversal or clinical cure is achievable by using lifestyle changes. This is a very important thing. So they're not saying that, hey, we'll give you this drug or we'll give you that drug. They're saying if you make lifestyle changes, you can actually just get your de-differentiated beta cells to become redifferentiated. So what are the lifestyle changes? Intensive insulin therapy. So this, you might say that, what the heck? Intensive insulin therapy? What does that mean? What they're saying over here is that the insulin, giving insulin to the body when a patient is in a hyperglycemic state. This has to be done under a doctor's supervision. When they give insulin for a couple of days, they would wash out all the extra glucose that is present, and they will bring the hyperglycemic inflammatory state down to zero. Not glucose down to zero, but the state down to zero. So that would be one thing to do to clear out the environment, to detoxify the environment of the glucoses. Then you start the therapy of, for example, intermittent fasting or controlled low caloric diet or low carbohydrate diet and fiber diets. And it doesn't matter that that has meat or not, carnivore or not. That's not the discussion. Just low caloric, less carbohydrate diet with fiber and with supplements, so that you can keep the supplements, nutritional values are correct. So insulin therapy and then controlled diet. So you bring the glucose levels down and you keep them down, and you allow the beta cells to have a relaxed environment. They're not afraid anymore, and they redifferentiate from the stem cell back into the beta cells. What else can be done? Bariatric surgery. We know that there are so many studies that show that when somebody gets a bariatric surgery, their insulin-dependent type 2 diabetes mellitus is reversed. It is a known fact. Then low caloric diet. We all can do that. Or carbohydrate restriction. We all can do that. Important thing is the following. Previous paradigm said, your beta cells have died. You just have to take the lower 1/3 of the plate this and 1/3 of the plate that, and that is just your life. This one is saying something else. They are saying do an aggressive therapy to bring glucoses enough down and to bring irritants, to remove the irritants and stresses away from the beta cells. Let them redifferentiate and you would have a normal pancreas again. That's what they're saying. That's the difference from the previous paradigm. Short-term intensive insulin therapy can improve the pathophysiological defects underlying type 2 diabetes mellitus. For example, insulin resistance, pancreatic beta cell dysfunction, alpha cell dysfunction. They say over here, Taylor et al. Have shown that type 2 diabetes mellitus is a condition mainly caused by excessive yet reversible fat accumulation in the liver and pancreas, and reversal of type 2 diabetes mellitus requires a reduction in fat content in the liver and pancreas. This is the 2-cycle hypothesis that was given by Taylor et al., that liver gets fatty and the pancreas becomes fatty, and that is what causes this problem. So when you lose weight, you actually reduce the fatty liver and you reduce the fatty pancreas. We have never heard of these terms normally in our doctor interaction. Once we do that, the beta cells go back being from stem cell to beta cells. The diabetes remission clinical trial demonstrated that the ability of beta cell in recovering their long-term function persists after diagnosis of the diabetes, changing the previous paradigm of irreversible loss of beta cell in type 2 diabetes mellitus. What an important thing, that they have shifted the paradigm away from beta cells are gone, this is your life now, and it is a chronic progressive disease. It's going to keep becoming worse. It's going to cause hypertension. Then it's going to cause cardiac failure. It's going to cause strokes. It's going to not cause, but it is going to become the underpinnings for renal failure, for neuropathies, and for immune system dysregulations, for COPDs. We have a different way of managing it in light of these studies. In addition, dysfunction of islet microcirculation is also involved in the pathogenesis of diabetes mellitus. So they're saying additionally, the circulation to the pancreas, if that is compromised, for example, clotting, microclotting happening in the blood vessels or inflammation in the blood vessels, nowadays much more prevalent in long COVID patients, vaccine injury patients. So that microcirculation, when that is compromised, that also would trigger the beta cell to go from a functioning beta cell back to differentiated stem cell. Dysfunction or destruction of the islet microenvironment caused mainly by abnormal microcirculation in pancreatic islets is the potential underlying mechanism contributing to beta cell failure in diabetes. What an amazing set of insights. What I wonder is why not our medical community, why do they not know it? Why do we keep doing, here is metformin, here is insulin, here is this drug, here is that drug, please walk more, please exercise more? Why don't they educate our people that you can become free of diabetes for free? Actually, you can save money when becoming free of diabetes. Therefore, improving the microcirculation of the pancreatic islets can increase the blood supply of the islets, improve the surrounding local metabolic environment, and contribute to the repair of damaged beta cells. Repair of damaged beta cells. Have you heard this before? In summary, beta cell dedifferentiation has been shown to be an important factor in beta cell dysfunction, but this dedifferentiation can be reversed by reducing metabolic overloading of beta cells and improving the local metabolic environment. So really, according to the newer studies, people who continue to stay stuck in the diabetic state, it is really that their cells are sitting in there praying to something to say, just give me a break and I'll function again. And we are not taught how do we give them a break. We just are not taught how to give them a break. So then they say this is, now they're talking about their own cases. This is a hospital where they set up a protocol where first they give insulin, short-term insulin for a few days, clear out the glucose as much as they can, and remove the hypertonic environment from the system and osmotic environment from the system. Then they start putting the people on the low-calorie diets and low-carb diet and more dietary fiber and more supplements. And patients become, okay, so this paragraph, check this out, how fast they get the result. We have incorporated the concept of protecting and restoring islet cells. This statement is another innovative statement. We have incorporated the concept of protecting and restoring beta cells, islet cells. Islet cells are the beta cells. There are alpha cells, beta cells, gamma cells, delta cells, but beta cell is important here. Thus, increasing beta cell functions in our extensive clinical treatment of diabetes patients. Within a short period of time on our regime, the toxicity of hyperglycemia, including damage to small and medium blood vessels and islet microcirculation, is reduced just by reducing carbohydrates. Concurrently, the biological activity of islet cells and insulin receptors is boosted, allowing the injured islet cells to acquire different degrees of repair, restore their normal function to various degrees, and produce more and higher quality endogenous insulin. So they say as we start improving the blood supply and as we start restricting carbohydrates aggressively, that not only improves the blood circulation to pancreas, but that also gives that relaxation to the beta cells that have become in fetal position, the stem cells, and they start restoring their function. In this way, not only can it control the blood sugar steadily, but also create good metabolic internal environment for the repair of the damaged islet cells. Under an appropriate environment, it is possible to repair the damaged islet cells or even reverse them to normal cells. You may not have ever heard of this statement before. Can you imagine this? And I know that Luffy is meowing outside. So if you just give me 1 minute, I want to open the door. He comes back in. He's outside. I'll be back. My apologies. Luffy and Kyrie were both outside. My wife is not home today, so the door was shut. Okay. Under an appropriate environment, it is possible to repair the damaged islet cells or even reverse them to normal cells. So, I'm sorry, I want to read a bit more of this one. With our systematic treatment regime to protect and repair pancreatic islet cells, a considerable number of type 2 diabetes mellitus patients in our hospitals have achieved the outcome of beta cell repair or even reversals in diabetes. Even reversals in diabetes. A recent case of a male type 2 diabetes mellitus patient with fatty liver, severe hyperglycemia, and beta cell failure was admitted to our hospital. Following a 3-week, look at this, 3-week treatment. 3-week treatment. Following a 3-week treatment, the patient exhibited excellent glycemic control with normal blood glucose levels and restored beta cell function without further need for blood glucose medications. In addition, his fatty liver disappeared. So what is their regime? What did they do? Our regime involved using first an insulin pump, short-term insulin intensive therapy to quickly remove the hyperglycemic state, improve hyperglycemic and hypertonic abnormal metabolic internal environment, and provide a metabolic local environment suitable for pancreatic beta cells to recuperate and repair. So first, they removed extra glucose from the body, which also means that when extra glucose is gone, then the metabolic states, the remaining metabolic state are also improved, which gives a good environment to the de-differentiated beta cell, the scared beta cell. Next, a systematic treatment to improve the pancreatic islet microcirculation was conducted. They did not tell what medicines. I would suspect things like aspirin or other blood thinners, which could be supplements as well. They allowed eventually to improve the blood circulation. There can be allopathic medicines too to cause vasodilatation. So to accelerate the flow rate of microcirculation and increase the ability and effectiveness of oxygen and nutrient supply to the whole body, including pancreatic cells. And I'll remind you that nowadays, since COVID, there are so many people who have vascular problems. In the meantime, So this is what they did. They gave insulin to remove the hyperglycemic environment of the body. Then they improved the blood flow to the whole body. I'm sure that they gave some sort of vasodilators, then blood thinners. In the meantime, the patient received normal diabetes education, which consisted of a proper diet therapy. Then what did they tell them, the patient? Low calorie, low carbohydrate, high dietary fiber, and high vitamin. They're not saying over here that take carnivore diet or take plant-based diet or this. They just low calorie, low carbohydrate, dietary fiber, so the person doesn't become constipated. When we take glucoses or carbohydrates, every carbohydrate glucose molecule binds 8 water molecules with it. Because of that, our fecal matter stays soft. When we cut carbs, we tend to develop constipation because there isn't enough water present in the fecal matter. So for that, dietary fiber, more hydration, whatever works, but fiber and hydration is an important part. Otherwise, it can become severe constipation. And a regular exercise schedule. Vitamins as well, because somebody who has cut carbs or is doing intermittent fasting, they may need to keep their vitamins correct. This is it. And one can improve the glucose environment by doing intermittent fasting as well. So you don't have to go and get an insulin pump and get that, but this is their therapy. And one can do some blood thinning with doctor's advice, with so many blood thinners that are nowadays very popular. And then low carb, low calorie, dietary fibers, and vitamins. The result, within 3 weeks, since the patient had diabetic peripheral neuropathy, atrophic nerve therapy was given to maintain the normal excitability of nerve fibers or repair the demyelination-like changes to the nerve fibers. For example, I do not know what therapy did they give, but imagine omega-3s or fish oils are very useful for the nerve repairs. Following the systematic treatments above, the patient was discharged with a normal blood glucose level. We are monitoring him closely to collect more data. This is the result of 3 weeks. So the links are in the description of this video. This is 2021. We were so busy with COVID that I think this got buried somewhere. So this is one study. I hope this study alone changes the whole thinking pattern. If you're a medical professional, then thinking pattern for how to approach the patient. And if you're a patient, then the thinking pattern how to manage your own disease or your loved ones. Okay, so if you're good, I'm going to go to the next study. BR says, really good lecture. Thank you very much. Janet says, gotcha. Thank you. So Janet says, is this type 2? Yes, this one is type 2. I'm going to go to type 1 in a second. I am going to take a lot of your time today. So pick up your coffee mugs and take coffee or whatever you would like. Okay, so this study good. Let's go to the next one. Dwayne says, patient compliance. Of course, patient compliance is always a problem, right? That happens always. Okay, so I'm going to go to the next one. This one is a beautiful study as well. And this has an article in American Diabetes Association. And then here is that study. This study is 2011. 2011. And here is the article, which is 2019. What are they talking about here? So this study, 2011, and now it's the very similar study. In this study, what they're saying is that there is a, let me actually show you where that is written. Twin cycle hypothesis. This was given in 2011. That is what I have open here. This is the twin cycle hypothesis. What this says is reversal of type 2 diabetes normalization of beta cell function in association with decreased pancreas and liver triglycerols. In 2011, we knew reduce fats on the liver and pancreas, and diabetes becomes reversed. We are still selling metformins and insulins to the world. So here is that study they talk about. But what I want to share with you is the result of reducing weight. And how does that help? So in this study, what they did was they had 11 people with type 2 diabetes were studied before and after 1, 4, and 8 weeks of, look at how aggressive the dietary restriction was. 600 kilocalorie per day, just 600 calories per day. But look at the results on diabetics. Again, please don't do them by yourself. Talk with your doctor, because calorie cutting and being diabetic and having hyperglycemia could become a problem. So check this out. After 1 week of restricted energy intake, fasting plasma glucose normalized in the diabetic group from 9.2 to 5.9 millimole per liter. It went so above 8. Fasting actually above 6 millimole per liter is abnormal. Here it went from 9.2. These were diabetic patients whose fasting plasma glucose was 9.2 millimole per liter. It went down from there to 5.9, normal, within 1 week. Insulin suppression of hepatic glucose output improved from 43 to 74%. This is something I want to explain. So my apologies for not having beautiful diagrams. So this is liver. At least it is a diagram of the liver or illustration. And imagine this is a hepatic cell, liver cell. What happens is liver cells or hepatocytes, what they do is they produce glucose. They perform gluconeogenesis, gluconeogenesis formation, new glucose formation. So even if you do not have glucose, even if you have not eaten glucose, liver cells can make glucose. This is why your baseline is at least 80 milligram per deciliter, because liver always makes you glucose, even if you don't have eaten any glucose. These cells, they respond to insulin. So when insulin is present in the system, think about it. When is the insulin present in the system? When you eat glucose or carbohydrates. Nowadays, any irritant that you eat can do that too. But let's go with normal healthy diet. When you take carbohydrates, those carbohydrates will cause beta cells to produce insulin. That insulin would come and attach to insulin receptors throughout the body, not just the liver. When the insulin is present, it means that there is glucose present in the system. If there is already glucose that the person has eaten, does the hepatocyte need to make glucose? No. So gluconeogenesis is stopped when there is ample insulin present in the system, which is an indicator that the person has eaten glucose from outside. However, in diabetics, because of insulin resistance, even when there is glucose present in the environment, which has caused the beta cells to produce a lot of insulin, and that insulin is here, the hepatocytes will still not respond to that insulin. They would still not realize that there is glucose in the environment because they're not responding to insulin. The result, they'll keep making glucose. So the diabetic is not only getting in trouble because of the glucose that comes from outside is staying and sticking around and not getting into the cell. It is sticking around in the blood circulation and interstitial fluids. But the liver is also contributing to the problem by making new glucose. Why? Because it is not responding to insulin. Cool Bean Patriot says this was pre-recorded a week ago. No, I'm live right now. So it's not a premiere. I am here. So uh, do you want to ask me how many fingers? Okay. So the glucose is still being produced by the liver. This is why sometimes the folks, diabetics, become surprised that, hey, I didn't take any carbohydrates, my glucose still went up. What happens is the liver can contribute. Now, when they started this aggressive calorie cutting, what happened was within 1 week, the glucose, the fats in the liver went from fatty to normal. I'll show you the number from 7 to 2. And the result was that the hepatocytes started responding to insulin. When it started responding to insulin, it stopped making unnecessarily more glucose. And things became normal. So that is what they're talking about. Insulin suppression of hepatic glucose. That insulin suppresses the gluconeogenesis by the liver. But in diabetics, that suppression by insulin has failed. And glucose continues to make, liver continues to make glucose. So insulin suppression of hepatic glucose output improved from 43% to 74%. And do you know the normal? The control subjects had 68% response. So the liver started responding even better than the normal people. Hepatic triglycerols content fell from 12.8 to 2. Plus minus 2.4 to 2.9. So that is the liver fatty liver reduced from 12.8 plus minus 2.4% to 2.9%. By week 8, 2 months, they cured the people. Luffy is singing the songs of his people because now he wants to go out. First he wanted to come in, now he wants to go out. Okay, the first phase insulin response increased during the study period 0.19 to 0.46 and approached control value 0.60. So what they're saying is that the glucose response to insulin became normal. Insulin's control over the body became normal. Maximal insulin response became supranormal at 8 weeks. At 8 weeks of this severe calorie cutting, please don't do it without a doctor's supervision. The response to insulin became supranormal, better than the controls, better than the healthy people. So what do you get? You get healthy liver, non-fatty liver, you get non-fatty pancreas, you get insulin resistance finished, you respond to insulin correctly, you start managing glucose correctly, you become healthy and even better than normal other healthy individuals. Pancreatic triglyceride decreased as well from 8 to 6. Again, fatty pancreas became non-fatty or less fatty pancreas. Conclusion: normalization of both beta cell function and hepatic insulin sensitivity in type 2 diabetes was achieved by dietary energy restriction alone. Janet says, I wonder if leptin signaling was involved. So number one, when there is fatty liver, the hepatocytes are compressed and stressed and they don't function correctly, plus fats make leptins, you're correct. Similarly, when there is fatty pancreas, the fat themselves are not only creating that inflammatory environment because of leptins, but they are creating a mechanical pressure on the cells as well because there are fats in there. So John says, did they look at the C-peptide levels? I am not sure that they did or not. But the important thing is that now more recent studies are also showing this result. In 2016, scientists reported that maintaining a healthy weight for 9 months after a period of weight loss assisted in beta cell recovery. Look where the science is. Beta cell recovery, beta cell becoming normal, beta cell redifferentiating, diabetes going away. We have to switch our mind from diabetes, chronic, progressive death news. From there to reversible, repairable, we can go back to normal. So here is another study, but I think I've made my point. So they just have two studies. One was this, that is 2011, and now they have more recent studies that demonstrate that as well. Good. Now I want to go to the next one. This is another study in a similar direction. Actually, this study is referenced by the other studies. Primary care-led weight management for remission of type 2 diabetes and open label cluster randomized trial. So here what they did was they managed people's weights. They caused just weight loss. Let me see if I can make the font bigger. Okay, so now not only the font is bigger, it's wider as well, the page. But if you see here, we did this open label cluster randomized trial at 49 primary care practices in Scotland and Tyneside region of England. Practices were randomly assigned via a computer-generated list to provide either a weight management program, which is the intervention, or best practice care by guidelines control. So here they're not doing anything else. You saw the previous protocol, give insulin to create a normal glucose environment, then give the foods and do all of those things bariatric surgery needed. Here they're just simply losing weight. So what did happen? Participants, carers, and research assistants, they knew the study except the statistician. That's fine. I want to read here. We recruited individuals aged 20 to 65 years who had been diagnosed with type 2 diabetes within the past 6 years. Had a body mass index of 27 to 45 kilogram per meter square and were not receiving insulin. The intervention comprised, look at the intervention, they were not insulin dependent, comprised withdrawal of anti-diabetic and anti-hypertensive drugs. Stop the drugs. Total diet replacement, 825 to 853 kilocalorie per day, formula diet for 3 to 5 months. So not as aggressive as 600 kilocalories, but 825 to 853. Stepped food reintroduction in 2 to 8 weeks. So after this aggressive 2 to 8 weeks therapy, then they would start the food reintroduction, but this time more controlled that, hey, you should eat this and you should not eat this and so on. And structured support for long-term weight loss maintenance. Co-primary outcome were weight loss of 15 kilogram or more. So 15 kilogram weight loss. Check out the results. I want to read the results here. So at 12 months, we recorded weight loss of 15 kilograms or more, participants in the intervention group and no participant in the control group. So the intervention group had weight loss, 15 kilogram or more, and the control group was just normal control group. Look at this. Diabetes remission was achieved in 46% participants in the intervention group and 6% in the control group. So you would say, well, lesser than half. Yeah, because some of the folks did not comply well. So those who complied well, they had 86% remission. So let's look at the results. Remission varied with weight loss in the whole study population, with achievement in none of 76 participants who gained weight. So that's so sad. So zero remission because 76 of them just actually gained more weight instead of going in remission. Sorry, losing weight. 7% of 89 participants who maintained 0 to 5 kilogram weight loss, not a lot, but still 6 achieved remission. Then those who had 34% of 56 participants with 5 to 10 kilogram weight loss, 34%. 16 or 57% of 28 participants with 10 to 15 kilogram weight loss. And 86% of 36 participants who lost 15 kilogram or more. Just weight loss. There's nothing else happening here. They actually had their hypertension and diabetes drugs taken away. No more drugs. Just lose your weight. 9 serious adverse events were reported by 4% of the 157 participants in the intervention group, and 2 reported in the control. 2 serious adverse events, biliary colic and abdominal pain, occurring in the same participant were deemed potentially related to intervention. So sometimes when you lose weight fast, the biliary colic can occur. Stones can form. No serious adverse events led to withdrawal from the study. Our findings show that at 12 months, almost half of the participants achieved remission to a non-diabetic state and and off anti-diabetic drugs. Remission of type 2 diabetes is a practical target for primary care. They're saying this is your practical target, doctors, primary cares, providers, to have the patient have a remission of type 2 diabetes. So tell me with a show of hand, how many people who may have diabetes or have their loved ones have diabetes that their doctors told them that, hey, we need a remission of your diabetes. We need to bring your pancreas back to normal. We can do that. How many have heard that? And we can just do that with your weight loss or with the calorie restriction or with a less stressful state in the body. So this one is 2018. Now the last study that I want to discuss is type 1 diabetes and how so Janet says nope, Cynthia says 0, Paul says I have never heard of this before, Sigrid says never. So there are studies. I'm presenting to you the studies, and good studies, not some some shady study from some bad journal. Good studies, good reviewed, better studies. Okay, so now I think you'll be thrilled with this one. I should probably do this one as a separate one so type 1 diabetic patients can watch it. They're not going to continue to watch till the 1 hour point to find out where is their related study. So maybe I'll cut the video from here, but check this out. In type 1 diabetics, the majority, there are many kinds of pathologies that give rise to type 1 diabetes, but generally, I'm generalizing, that our immune system attacks our beta cells and destroys them. So these patients do not have beta cells. And so they progressively become diabetic as more and more beta cells are destroyed. And it depends upon how aggressively the immune system is attacking. Some become diabetic in childhood, some become in younghood, and some in adult life. But not adult life of type 2 diabetes, meaning early life. How do they live? Then these patients become insulin dependent. This study showed, and this is only the second study of this kind. This was done before as well, and this is the second study. This study showed that you can take pancreatic glandular cells, non-beta cells, and convert them into beta cells by using FDA-approved drug for sarcomas or cancer drug. So let me go to that drug for a second. Man. So here, FDA approved EZH2 inhibitors, JSK126, and tazimetostat or TAZ. So these are the drugs that are approved for cancers. So this is why they are not going to they're not going to be given to type 1 diabetes patients to say this would recover your pancreas, but they can now take their pancreatic cells and they can convert them back, or they can coax them to become beta cells. So that's what I want to show you. A few weeks ago, there was a study from China where they took some cells from the body of a person, then they converted them back into the stem cells, then they coaxed those stem cells to become beta cells. And that was a big deal, and I discussed that. Here, this is a slightly different thing. So let me first explain it, and then we'll look at this diagram and the explanation. So imagine that a type 1 diabetic does not have beta cells anymore. They are diabetic, they're insulin dependent. So in their pancreas, they have pancreatic glandular tissue is something like this. Okay, don't kill me if I am not drawing a very good diagram. So these are called SNI, and these are ducts. And here is, let's say, the gland opens up. So there are cells around here that make whatever we need. For example, in this case, something, insulin, let's say, and then that is released here. What they found was that in these ducts here, there are stem cells that live here amongst other cells. So this one is a stem cell that lives here, and it does not make insulin, and it has nothing to do with insulin. It just is a stem cell sitting there. They took this stem cell or stem cells from a person, and they cultivated them in lab. Now, please remember, to get a donation of a pancreas, one has to have 3 pancreas available from some people who passed away, and then take their beta cells to make 1 pancreas. So here they took the person's own pancreatic cells that were not even beta cells, and what they did was they put this drug on them, the TAZ drug, and guess what happened? They found out that these cells, these glandular ductal cells, duct is the canaliculi through which the things are secreted. The ductal cells had their DNA. So if I look into this nucleus, let me make it bigger. So if I look in the nucleus, this cell is not a beta cell, it's a ductal cell, right? So the genes for insulin secretion are locked in here. These are locked. So this cell, ductal cell, can act like a ductal cell or surface cell, but it cannot act like insulin producing cell. And if you watch my video about the Chinese study, they went through a huge set of steps to kind of coax a cell to become stem cell and then coax it back to become a beta cell. Here, this team just simply put TAZ medicine on it. And the TAZ medicine went in and opened up the lock for the insulin producing genes. And all of a sudden, this cell converted to a beta cell like cell. Not exactly a beta cell, but a beta cell like cell. And it started responding to glucose levels and started producing insulin. So imagine a type 1 diabetic who they take a tiny biopsy, a tiny set of cells from them, they culture them in the lab, then they put TAZ on it, and they immediately become beta cells. Then they inject those beta cells back in them, and done. So check this out. Here in this diagram, this central part here, the reddish thing, these are the islet of Langerhans. These are where the beta cells live. Around those are the ducts So if you see here, duct, D-U-C-T, duct, not duck. So ducts from where the insulin will become released. So normally our glands work in this way, that we have glandular cells are kind of connected around a uh, ductal system, and they pour their secretions into that duct. From there, then the secretions come out, just like we make sweat the same way as well. And so the sweat drops come out of this duct. So the ductal cell here pancreatic acini is a piece of pancreas. And then here, latent plasticity, we have pancreatic and ductal progenitor cell. These are stem cells sitting there. And they are showing here that these stem cells have the genes that are responsible to make insulin. These genes are locked. What is that gene's name? H3K27ME3. This gene is locked. So now the patient has the normal beta cells destroyed. The ductal cells are not attacked by the immune system because they're not beta cell. They do not have that abnormality. Then they take those ductal cells, they put these drugs, GSK126 or TAS. When they put that, the insulin-producing gene becomes open. When that becomes open, this cell differentiates into a beta cell-like cell. Remember, it's a progenitor cell. That means it's a stem cell. It becomes differentiated into a beta-like cell. That is, it responds to glucose and it makes insulin. So that is what they describe over here. Pharmacological inhibition of, I do not know if you want to hear this technical thing over here, but they're saying that the EZH2 catalase pancreatic progenitor activation and beta cell maturation. The schematic outline shows, the progression of activating the stem cells back to beta cell. And now this can become an autograft. Autograft is when I get a graft of my own tissue. You take some cells from me, you culture them, you make them bigger in number, and then give them back to me. That is an autograft. I gave donation to myself. Now, these cells worked as normal beta cells. Can you imagine this? So this can actually reverse or kind of provide new set of cells. And imagine that those new set of cells start getting attacked by the immune system as well, and another 20 years later they are dead as well. Well, just make new. Maybe I have a desire to create a startup, but I do not have enough resources, which is called Phoenix. That is we coming out of our own ashes, and that is to give ourselves a donation of parts of our own body tissues. And whenever we need them, we just culture them and we grow them and we give them back to the person instead of getting a donation from somebody else. So imagine in the future then, there will be these tissue banks who would take a biopsy of a cell once and they would just culture the beta cells from a younger patient. And if a patient has become type 1 diabetic, they can take a small biopsy of the pancreatic cells, coax their ductal cells with this FDA-approved drug to become beta cell, culture them, keep some in the bank, give the rest to the patient. If the patient comes back 20 years later and says, I need more, they can just reculture them and give them more. Paul says that perhaps the beta-like cells will not be attacked by the, correct? It is possible that they may not have all of those markers that make them a target. In some cases, the insulin production is bad, but yes, you're correct. Perhaps they will not be. So John, I just responded to that. So if the immune system destroys them, then you reculture them and put them back again. So good. And you could even, as they are in the lab, you could even remove those markers to which immune system attacks. And so you could actually make them immune competent, immune tolerant. or immune system make them tolerant to them. Or I should say it correctly, you can make them non-immunogenic. And all of a sudden, the patient has good cells. And I'm sure that type 1 diabetic patients would appreciate their pancreas becoming healthy again. Cool Beans Patriot says, this was supposed to be a chit-chat question. Why the change without notification? This is why less watching. Sorry about that, but I wanted to make sure that we have these studies in front of us. So then Cool Bean Patriot says, did you not know that Lancet was shady on its hydroxychloroquine study in 2020? Could you do a video about that, please? I think that we'll see if we need to. We all knew things and we all did things. And I talked about hydroxy as well. So Luffy is making noise. All of these links are in the description of this video. And please feel free to review those links, share those links with somebody who may be diabetic type 1 or 2. And then I was actually only planning to do this with the patrons, but today I thought this is such an important topic that we should all know about this, because diabetes is a huge problem. So John says, super important papers. Thank you for sharing these, Dr. Wing. You're very welcome. Thank you, John. And so that is a discussion. Description of this video has the links, and I would request you to support this work as well if you can. And that is the end of our talk. Thank you, Paul. You're very welcome. Les is very, very interesting. Thank you. You're very welcome. So diabetes can be reversed. So just keep that in mind. And even type 1 insulin-dependent diabetics have hope now. So John says, do you know how the biopsy is done? So sometimes the biopsy can be done through the ductal system. So pancreas has its own little ducts that finally open in the duodenum. And one can insert the biopsy needle from there as well. Sita says, glad you shared with us. Thank you. Cynthia says, thank you. Excellent info. You're very welcome. Fruit. Yes. Guys, is fruit or vegetable? Pomegranate. Pomegranate is very important for urolithin A. Cami says, thank you very much. You're very welcome. So with this, thank you very much. Have a good evening. And I would see some of you tomorrow morning for our Cool Bean walk as well. Thank you and have a nice weekend.